Hello, everyone. Thank you for joining this listening session on the reporting requirements for the Janssen and Distributors settlements. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we are helping the Department of Healthcare Services facilitate today's webinar on the proposed reporting requirements for California's participating subdivisions receiving funds from the Janssen and Distributors settlements. Next slide, please. Just a couple of housekeeping items before we begin. If you have a technical question during today's webinar, you can please send a direct message to Kate Roberts from the Aurora team, and she will help you with troubleshooting any issues that you have. Questions and feedback can be submitted at any time via the question box on your GoToWebinar control panel. That's on the upper right-hand side of your screen. Today's meeting materials will be available following the webinar. They will be posted to the DHCS Opioid Settlement Funds webpage, so you'll be able to access these slides after the webinar at that page. Next slide. I want to cover briefly the listening session format for today. During this listening session, DHCS will be requesting your feedback on the reporting process for the Janssen and Distributors Settlement Funds. During this session, DHCS will provide a series of prompts to specify the types of feedback that would be helpful for DHCS to consider in creating the proposed reporting form. We will solicit stakeholder feedback on each of these prompts. DHCS will not respond to feedback during the listening session, but will aggregate feedback and make it available after the listening session on the DHCS Opioid Settlement Funds webpage. Next slide, please. Ways to provide feedback to today's content. There are two ways that you can provide your feedback. The first is to type comments into the questions box located on your GoToWebinar control panel. And we will be taking some pauses during the presentation to read back some of the feedback that we're receiving so that we can share that with you all. The other way to provide feedback for today's presentation is to send an email to oss@dhcs.ca.gov. Feedback on the topics addressed during this session will be accepted through January 15th of 2023. So feel free, if you have thoughts or questions that occur after this presentation, to please send them to that email address, and they will be collected there for DHCS to review. Next slide. During this session, DHCS will provide an overview of the Janssen and Distributors settlements before sharing information about plans for Janssen and Distributors settlements expenditure reporting. As I mentioned, we will pause at intervals throughout the presentation to read feedback and questions. If you'd like to submit comments via email, please do so by January 13th, 2023. And I'd also like to announce that DHCS is planning to hold an additional listening session next month discussing allowable expenditures with the Janssen and Distributors settlement funds, and that will be held on January 26th from 12 o'clock to 1 o'clock p.m. Next slide. So with that, I want to turn it over to Marlise Perez from the Department of Healthcare Services, who will walk us through an overview of these settlements and the proposed reporting requirements. Marlise is Chief of the Community Services Division at DHCS, which is tasked with overseeing use and reporting of settlement funds among the participating subdivisions. So Marlise, I'll turn it over to you.
Great, thank you so much, Chelsea, and thank you all for attending today or listening in at a later date. We're really excited to be the oversight entity over the Janssen and Distributors settlements. And so what we want to do today is provide you with some just background information and then move into what we've been looking at for the reporting requirements. And then just really most of today, what we want is your feedback. So please, when we get to those slides, please feel free to chat in your comments. And then also, if you think of something later on over the next few weeks, do the feedback through the methods that Chelsea talked about, and we'll recap that at the end of the listening session. So next slide, please. Great. So as all of you know, we have been facing a opioid overdose epidemic at the state, national, local level. And so with that, there have been several lawsuits that have come against different entities. And so I just want to emphasize today, all we're going to be talking about and addressing is the Janssen and Distributors you'll sometimes see on the slides J and D. We won't be talking about any other settlements, and we also won't be talking about any other opioid funding. And the primary focus with the J and D settlements is around the reporting requirements. Next slide. So with the J and D settlements, California is expected to receive around a little over $2 billion. And that funding is going to be paid through 2038. Of course, both of the settlements do have different expenditure periods, but the majority of this $2 billion in funding will be going to participating subdivisions. And of course, all of this funding will be used for opioid abatement activities. And so while DHCS is providing all of the oversight roles around monitoring, data collection, technical assistance around allowable expenditures, all of the funding and the payments themselves will be made by the National Settlement Administrator, which is Brown Greer. Next slide. And so as I mentioned, we are tasked with overseeing the participating subdivisions. And so this listening session is going to fulfill one of the requirements that is outlined in the state subdivision agreements. There's two of those, and that mandates our department to meet with representatives of the plaintiff subdivisions. So that is why we've invited you here today to receive this feedback. And so just to give you a little overview of DHCS's role with these settlements. So as I mentioned, we are responsible for monitoring the participating subdivisions for compliance to the terms. We are also responsible for designating additional high impact abatement activities. We are responsible for conducting stakeholder engagement. We'll be providing with some technical assistance as well, and preparing annual reports. Once again, all with the focus to ensure that all of this funding in California is used for opioid remediation. Next slide. All right, so let's dive into a little bit around the allowable expenditures. Next slide. So as Chelsea mentioned, we are going to be hosting a listening session in January around allowable expenditures, but we didn't want to leave today without touching on this just a little bit, but just so you know, there's going to be much more of this to come in January. So all of this information comes from the settlement agreement, but Section 1 identifies that no less than 50% of the funds have to be spent on high impact abatement activities. And then in Section 2, the participating subdivisions can choose among the abatement strategies that are listed in that larger national settlement in Schedule B of Exhibit E from that list. However, just that priority should really be given to those core abatement strategies that I mentioned up in Section 1. Next slide. And so we just want to run briefly through these high impact abatement activities. And so you'll see here, the first is participating subdivisions can use these funds to provide matching funds or operating costs for substance use disorder facilities within our behavioral health continuum infrastructure program. And just so you're aware of what that program is, if you haven't heard about that, that is $2 billion that is being put towards California's infrastructure for mental health and substance use disorder facilities. So this funding could just be used as a match for the SUD facilities or operating costs. The second is creating new or expanded substance use disorder treatment infrastructure. The three is addressing the needs of communities of color and vulnerable populations. This includes homeless populations and other populations that are disproportionately impacted by substance use disorder. The fourth is the diversion of people with an SUD from the justice system and moving them into treatment. That could be in the way of training, resources. It could also be implementing best practices around outreach, diversion, deflection, employability, and other areas as well. The fifth is interventions to prevent drug addiction in vulnerable youth. Next slide. And so with the Schedule A, the core strategies, so these are just some of the categories that are listed in Schedule A. So you'll see here, I'm not going to go through all of them today, but we are going to go more extensively into these, not only on our listening session in January, but we also will be providing you just some infographics, other items like that that'll be helpful for you as you're planning out how to expend these funds. Next slide. All right, so this is the heart of why we've gathered you today, is to really get your feedback around the expenditure reporting process. Next slide. So while developing these reporting requirements for the J&D settlement, DHCS really just wants you to know that our guiding principles around this are that the reporting requirements that are already laid out in the J&D settlement, that's the basis for the information that we're requesting. And then all of this data is going to be transparent for the general public, and that we're going to, show and demonstrate that this funding is being used according to the terms outlined in the settlement. We also, a guiding principle is that these requirements incorporate your feedback as stakeholders that are going to be expending the funds and then reporting them to DHCS. And then another thing we're also looking at is how do we make these reporting requirements, how do we design them to be able to potentially use for future settlement reporting, recognizing that there are other settlements on the horizon and that you will be reporting those to DHCS as well. So we're trying to think forward in that space for ease and convenience, and also for the transparency of when we show this to the public. Next slide. All right, so what DHCS has been doing is we're working to develop an online data portal for the expenditure reporting that the participating subdivisions will be utilizing when submitting the information to us. So participating subdivisions will be required to enter the data into the portal once a year. Subdivisions that opt out of direct payment will not be required to report. And then subdivisions that receive direct payment and choose to transfer the funds to another subdivision, they will be required to report. Next slide. So the online data portal is going to be available to participating subdivisions. We're going to have it available to you prior to the first reporting period. We're also going to be providing training how to utilize the online data portal. Participating subdivisions will be providing planned expenditures for the coming fiscal year, and then they will also at the same time provide an annual report of the prior year expenditures. So the reporting will provide DHCS with the information we need for a required annual report, in addition for DHCS to be monitoring that compliance to ensure that the settlement agreements are being met around allowable expenditures, and once again, that all of the funding is being used for opioid remediation activities. Next slide. So this is the expenditure reporting timeline that we're looking at. So in November of this year, just last month, the first payment came out to the subdivision. And so what we're looking at is having August 31st of next calendar year, 2023, is that the expenditure reports for the state fiscal year of 22-23, which we're currently in, those would be due at the same time planned expenditures for the state fiscal year 23-24 would be due. And then you'll see here we would follow the same pattern for that next reporting cycle that would occur August 31st of 2024. Next slide. Great, so we are at our first feedback slide. So I'm going to baton it back over to Chelsea, and she's going to walk you through this feedback process.
Great, thank you, Marlise. So in this part of the presentation, we're going to pause and request your feedback as it pertains to the proposed reporting requirements for the Janssen and Distributors funds. And so I'll read the questions on the screen, and then we'll briefly turn back to the previous slide to allow you to see the information again. And then after that, I will read some of the feedback that we are receiving. As a reminder, DHCS won't be responding to feedback today, but will aggregate and provide responses after today's presentation. So the questions for your feedback on this slide are, is the timeline for annual expenditure reporting feasible for your subdivision considering your budgeting and contracting processes? And would you prefer to report expenditures on a more frequent basis than annually? Amelia, if you could turn back to the previous slide and we'll pause there for a moment. And while folks put their comments and feedback in the question box, I'll just address some of the questions that have been coming in related to when the slides will be, where the slides will be available, whether they will be sent out to participants. We will be posting the slides. We'll work with DHCS to have these posted on their website on the DHCS Opioid Settlement Funds webpage. And we can share a link to that in the chat as well. And we're getting some feedback regarding the timeline. So one participant says that this timeline is feasible for expenditure reporting. Another person says annual reporting is fine. September is better for reporting based on when their books close. Thank you for that feedback. Some other responses, folks are not inclined to report more frequently than annually, it sounds like. So annual tentatively sounds good. Some more feedback coming in that the timeline is a little bit hard as they are closing their books at that time and have lots of requirements around that time frame. So this person notes that 1 extra month would be nice. And they also agree that no more than annually reporting is their preference. All right, I'll pause and see if we get more submissions. And while I pause, I want to also just note that some of you seem to have questions around payment and how you're going to receive your payment. I believe, as Marlise noted earlier, DHCS is monitoring, providing guidance and information about expenditures and reporting. However, subdivisions will receive their payments directly from Brown Greer, the National Settlement Administrator. So for any of those types of payment questions, timeline of payments and things like that, you're going to want to turn to Brown Greer for that information. All right. Well, it looks like the feedback that we're getting is generally that annually is preferred, but some folks have feedback that the timing might be a little bit difficult with some of their other budgeting and expenditure processes. So I think we can pause there. Feel free to continue to submit your feedback in the chat. We will incorporate it into the analysis after this presentation to inform DHCS's planning around the expenditure reporting. But thank you for that feedback. It's really helpful. And I'll turn back to Marlise to continue us through the presentation.
Great, thanks, Chelsea. If we could move to the next slide. All right, so for our next topic is we want to do a little deeper dive into what would be required in the actual expenditure reporting document. And so participating subdivisions, this is kind of the list of what we're looking at being required to report. So this would be the amount of settlement funds that has been received and expenditures for that prior state fiscal year. And this would also be for each settlement and fund type. Just as a reminder, right now there's the Janssen settlement and the distributors, so there'd be different line items for both of those. And then under each of those would be for abatement account funds and then the subdivision funds. We'd also be requesting a brief description of the funding activities. You'll see here corresponding to the Exhibit E. Any interest earned on the settlement funds, any transfers to or from other subdivisions, if that applies in your situation, any legal expenses, if the subdivision is both a plaintiff subdivision and an initial participating subdivision. Next slide. Other expenditure information is, and these come from the settlement terms around the funds have to be expended or encumbered within 5 years. Funds for capital outlay projects have up to 7 years to be expended or encumbered. Funds may be rolled over between years as long as they're, spent in accordance within those 5-year or the 7-year requirements, depending on the fund type. Expenditures must be reported annually until they are fully expended. Funds not spent within the requirements will be sent back to the state. And then if there are no expenditures for that reporting year, the report still needs to be completed and then needs to reflect 0 expenditures. And then that rollover funding needs to be accounted for in the planned expenditures. Next slide. All right, Chelsea, it's back to you to get more feedback from our participants.
Great, thank you, Marlise. So next we will ask for your feedback on the required reporting items that have been proposed. So Millie, if you could turn back to the 2 slides before this and just give a brief pause so that folks can take in the information and submit their feedback and comments. We'll take a brief pause now so that you can look at the list. And if we can go to the next slide. All right, and let's return to the questions. So the questions for feedback are, do you have any concerns with the required reporting items? And are there any reporting items that are missing from this list? And so in terms of concerns with the reporting items, one commenter responds in terms of planning for the upcoming state fiscal years, are we expected to receive the same amount of funding every year for planning purposes? So some questions around the amount of money and whether it may change year to year. Another person asks for more information about reporting for each settlement, Janssen and distributors, and reporting each of those separately as 2 different settlements and the different payments that will be coming for each of those settlements. Another person asks if they're required to earn interest on these funds. So something for future technical assistance and information is some more information to subdivisions then around any interest earning requirements. Another person asked for clarification around the 5-year time frame for spending from the first allocation. So some clarifications from DHCS in guidance around those time frames for spending the funds. Another person notes that their city is receiving perhaps a smaller amount annually and asks if there is any streamlined reporting available for agencies that receive small amounts of funding. And while we're waiting for more feedback to come in regarding the reporting items, I'll just return to a couple of items of feedback that we received after the last feedback slide regarding the timeline of expenditures, reporting of expenditures. This person notes that counties need time to develop programs, and it often takes 6 to 9 months to implement a new project. So they wanted to note that sometimes it takes a little bit of time for counties to get new programs off the ground. And another person notes that a 60-day deadline for cities with a fiscal year end of June 30th is a tight deadline for reporting. So more echoing that commentary, that more time would perhaps be helpful there. Another question came in around legal expenses of outside counsel and internal counsel. And so it looks like perhaps some clarification for when and who can spend funds on funds that are outside of opioid remediation and more related to past or present legal expenses. Another person asks for clarification on the difference between the abatement fund and the subdivision fund, so noting the need for perhaps in that upcoming webinar to provide a little bit more information about these different funds that are the segmented funds that are coming from the Janssen Distributors settlement and have some sort of specific differences in terms of how they can be used. Another person asks, once encumbered, how long do you have to spend the funds? And another person asks about reporting on administration and indirect costs for managing the funds. Some other questions have come in as well around what the funds can be used for and whether they can be used to support homeless populations receiving these services. So again, sort of looking back to some of those allowable expenditures that are listed in the previous slides within the presentation, as well as in the settlement agreement. Another person asks, will outcomes be requested? And so kind of part of the format of what that form will look like and whether the subdivision will be required to report on outcomes of those activities. All right, well, I think that's all of the feedback so far. Please feel free to continue to provide your feedback in the questions box. But with that, I will turn it back to Marlise to go through the next set of slides.
Great, thanks, Chelsea. Next slide, please. And so want to talk a little bit about what could happen if the participating subdivisions fail to report. So participating subdivisions who did not submit their report by the deadline, they will receive an electronic notice from DHCS regarding the missing report. And then any reoccurring failure to submit a timely report may result in a meet and confer with DHCS, an audit, or legal action. We hope not to get to that space. We're hoping for timely reports. And just a reminder, we are utilizing all of the information that you're providing, as DHCS is then required to submit an annual report on all of the information that you provide us. Next slide. Oh, so we're at the feedback. One thing I did just notice before we moved, can we go back really quick? I do just want to highlight, there's a little footnote here. We have put out surveys to our participating subdivisions with the contact information that we have received with our partners at the Attorney General's office. And I really just want to put a little plug in here. We haven't heard back from all of you, and all of it is really just providing us with who your primary contact is. And we really want to ensure that that information is correct. So we can be communicating with you, you can be receiving opportunities like our listening sessions, other technical assistance, but just so we have that. So if you haven't done that, if you could please do that. And if you have no idea what I'm talking about, please just send us an email so we can reach out and provide you with that survey. And with that, I want to turn it over to Chelsea to walk us through our next feedback session.
Great, thank you, Marlies. And if we can go to the next slide. All right. And so in this one, we are asking you about methods that you would like DHCS to employ to ensure compliance with reporting submissions, as well as how DHCS can assist with ensuring the timely submissions of reports. And so this is our last feedback slide section. So please send in your feedback to this slide to these questions, or you can submit for any of the previous questions as well, and I'll read them. And so just to note, this will be the last portion of the presentation where I will be reading back the feedback on the webinar itself. However, anything that you do submit to us in the question box will be taken and reviewed in consideration with all of the other feedback that we've received. And as well, as we mentioned earlier, we'll have until January 13th to also submit any feedback to the OSF HCS box. So just to note that. So with that, I will review some of the feedback that we're receiving. So a couple of folks note that they'd like reminder emails sent 30 to 60 days before the due date. Always helpful to have a reminder. Another person notes that they would like trainings on how to complete the reporting requirements, which certainly DHCS will provide training on how to complete that form and provide a walkthrough of that in advance of when that reporting is due. Another person notes that they would like a schedule of due dates as well as reminder emails. So, you know, a list of when those due dates will be happening. Another person notes a standardized tool for reporting. Someone else notes that they would like the online the reporting tool to be online, in an online format. More echoes about reminder notifications. Someone asks about requesting an extension process, if there is anything regarding extensions. Another person notes that they would appreciate having more time after the close of their fiscal year to be able to complete reports. Their feedback is that 180 days would be helpful. They also note that trainings and access to timely help for the online platform would be helpful to them. Another person notes that they would like to see meetings that are specific to this funding to share best practices, information, share concerns, things like that. Another person asks if there will be an audit for this in the future, whether these funds could be audited in the future. Another response says they would like a dedicated contact for technical assistance and questions. And another response says that it would be helpful for DHCS to designate a particular area on the website for all opioid settlement requirements, reporting, training, etc. More echoes for providing standardized reporting forms, outcome reporting, and expenditure reports. Another person asks about a method for receiving approvals before spending funds, and whether that's possible. Approval for their plan. And as a reminder, with these types of questions, if you do have questions about the use of funds, feel free to email the OSF inbox. oss@dhcs.ca.gov. And you should receive a timely response about information about allowable expenditures. Another person says they'd like a forum in the online portal where subdivisions can post questions and receive DHCS responses. Another person notes that they like one-on-one meetings with subdivisions, so request technical assistance meetings with DHCS to answer questions and get clarification. Another person notes that they would like approval for planned expenditures from DHCS. Another person says that they would like a clear reference guide document on how to complete the reporting tool. Another person asked about whether there is a formal RFP process to apply for the funds. So again, with questions about funding and payment, when you can expect to receive payments, how to become a participating subdivision, many of those questions really will be better answered by Brown Greer, the National Settlement Administrator. And then it looks like we're getting a lot of comments that just note that folks would like one-on-one technical assistance. All right, well, I think that's all of the feedback that we have for now. So as I mentioned, we will be collating and putting all together this feedback for DHCS to review after this session, and DHCS will aggregate the feedback and provide information following today's session. So with that, I will want to thank you all for putting your feedback in the chat, and I'll turn it back to Marlise to wrap up. Oh, Marlise, you may be muted.
Sorry, somebody double muted me because there was a horse clomping around. I don't know if anybody heard that on the line. Anyway, I just want to thank you all for attending today. And just to let you know, this feedback has been really valuable for DHCS as we move forward in not only completing the reporting requirements in the online data portal, but also a lot of your questions as well. It's going to help us shape where we need to go, how we can help you provide the assistance, the technical assistance that you need moving forward, not only with the reporting of expenditures and planned expenditures, but also as you're implementing these funds from Janssen Distributors at the local level. So huge thanks. You're going to be seeing from us, just like Chelsea mentioned, we're going to be posting some of the themes that came out of today and also any additional feedback that we receive. And then we're also just going to see a lot of opportunities for you to, over the next year in 2023, participate in technical assistance opportunities. Of course, you can always reach out to us. We have that email box. I do just want to put one more plug in. If you have not notified us and responded to the survey about the liaison, that would be fantastic if you could complete that. And as we continue to roll this out, we'll be posting items like FAQs or other things that we feel can help you, really combat this terrible epidemic that has just really ravaged our nation and our state of California. So I just want to, as we close, I really want to thank all of you for your role in being part of the solution and just really helping, really implement harm reduction, prevention, treatment, recovery services around substance use, and all the great work that this funding is going to do. So thank you so much. Please, continue to provide us feedback, and we hope to see you back in January for our next listening session around the allowable expenditures. So with that, we're going to sign off, and we'll see you in January.